I'm Kristen with Head, Shoulders, Teeth, and Tongue, and today I've got Dr. Brittany Johansen, and she is awesome. She is highly skilled in airway dentistry, and that is all she does. She doesn't do any regular dentistry like you would think, like fillings, crowns, like all those kinds of things. She focuses on airway, and I'm super excited for her to be here with us because she knows all about it. I would like to get into some of the details here and knowing kind of what you do to help a child. On your website, you've got several details. You said that you use Myobrace, and which sounds kind of like braces, but it's not, right? It looks kind of like a mouth guard on steroids. And it's amazing that this is going to help with expansion, but could you tell me just a little bit more about how that works and when you use it and kind of what goes along with that program?
Sure. So I have my box of demo models here, and I
Yes.
can show this is what a Myobrace is. And I really like the Myobrace for kids because it's helping teach the proper muscle habits. So myofunctional therapy, which I send some of my patients to you to get some of that done as well, really is important as well. And this appliance is just helping sock in some of those different things that we're trying to teach. So this is a tongue tab. The tongue goes up to touch that tab at the proper spot. If you say the letter N, your tongue should go behind your central incisors. And then if you just lay your tongue up, that's how it should be resting on the roof of your mouth. This helps elevate to get that tongue into that position. And these help the lips and the cheeks from being overactive. So why that's really important is the tongue can exert up to 500 grams of force on the roof of the mouth, the palate. Well, if your tongue isn't sitting on the roof of your mouth, thumb sucking habit, bottle habit, binky habit, low tongue posture, well, now the lips and the cheeks are taking over, and the lips and the cheeks can exert 1 to 300 grams of pressure. So in a fully cohesive system, you're still getting expansion because 500 outweighs the 1 to 300. But if your 500 isn't going up to the top, if the tongue isn't to the roof of the mouth, the lips and the cheeks are winning, and now you get that narrow palate, high vaulted arch, and the roof of the mouth is the floor of the nasal sinus. So if you're squishing that, you're also narrowing up your nasal breathing space. And we can talk all about the importance of nasal breathing, but your tongue is an important scaffold system of the maxillary bone. So I really like Myobrace because the muscles are setting the tone for the bone. So we really want to teach the muscles where to go. Also, what the Myobrace does is it helps keep that lower jaw just slightly forward. So when someone goes to sleep at night, that jaw isn't falling backwards. And what that can do, bringing your jaw forward, your tongue is attached to your jaw. And if you bring that lower jaw just slightly forward or don't let it fall back, the tongue is up and out of the airway, helping you breathe better at night so you can get your full cycles of sleep, which is so important of all those other things. Like I said, I can go on about lots of different things, but I'm like wanting to let you ask me questions of what other people want to hear and what I do. But Myobrace is pretty cool. There's a lot of other systems out there, and their brand names: Kleenex, Tissue, things like that. So I use Myobrace because that's what I've started with, and that's where I've seen the results. But very similar other growth guidance appliances can do similar things. And if you have it with someone who's doing the right protocols, nasal breathing, myofunctional therapy, and what we've added in our office as well would be cranial manipulations just to help the bones in the head to align right as well. So there's a lot of other things that you can add on top of that. But the growth guidance appliances are great.
Another patient asked, why does that, and you kind of alluded to this just a little bit when you mentioned that you've got this growth system, that you also, use some cranio-sacral therapy, and in myofunctional therapy, why does it take so many systems to get this to work? Like why, when they come see you and then, sometimes they're referred to me and then sometimes, they need cranio-sacral or they need maybe like a chiropractor or something else. Like why? Why do I need all this stuff to fix this area right here? That's a great question, right? And so I was hoping I could get your input.
Well, what's the start of that chain? The jaw joints. And what's a big portion of the proportions of the whole craniofacial region? The maxilla. It's that keystone with different things because it articulates with so many other bones in the head through so many other different connections. So chiropractors help with that, cranio-sacral therapists help with that, dentists, whether they know it or not, really affect that as well. ENTs. And so there's a lot of different ways. There's a lot of different ways to get from point A to point B. But where I find the stability in the system is when you go to a chiropractor, it's really great. They help align your spine. Now you're getting better neurology and nerve flow and blood flow through that. But what can throw it back out of whack? Those muscles. Well, why are the muscles overcompensating? And oftentimes it's because of the way your teeth are coming together or not coming together, because they have that ability to throw off that system. And so when I see someone get treatment to balance out their jaw, their chiropractic treatments hold better and hold longer because the occlusion is stabilizing force. Everything works together, and your head can really affect your toes.
Yeah. And I love that you got a skull because I've got, something with all the muscles, right? Because as a myofunctional therapist, I'm working, myo means muscle, right? And so I'm always pointing out, this muscle and this muscle and this muscle. And then also pointing out, hey, if the airway is not open, right, then all because all these muscles are then being pushed into the airway. Why? Because the jaw is so small. And there's, the sign of like crooked teeth or crowded teeth is a sign that the muscles are not supporting that. And I'm constantly explaining that. So yeah, you explain it very similar to the way I explain it, is all of these systems, right? The bone system, the muscle system, the nervous system, which is, all the nerves, that those all have to work together. And if they're not working together as we grow up, then we're going to be constantly compensating. And then we have to work on all of those things to get you back to healthy. And so that's why it usually takes multiple providers if a person grew into poor function and poor structure. To fix that, we want to fix the function and fix the structure, and that it all supports each other. So I love that. That's awesome. Thank you so much, Dr. Brittany. I really, really appreciate this. This has been so fantastic. So much great information, and now people know where they can get started. And if they want to come see you, you're in Alpine, Utah, and
Yeah.
they can get started.